Could Tylenol truly increase the risk of autism when taken during pregnancy? The Trump administration has reignited this heated debate, issuing a public warning that's left doctors, parents, and health professionals across the country fiercely divided. But here's where it gets controversial. The scientific community remains unconvinced, pointing to mixed evidence and urging caution against spreading panic. On Monday, President Donald Trump took the podium at the White House, announcing that the Food and Drug Administration, FDA, would immediately urge healthcare providers to advise pregnant women to avoid Tylenol, acetaminophen, unless it's absolutely necessary. We're strongly encouraging women to avoid Tylenol during pregnancy, except in specific situations, such as when battling a high fever, Trump declared. The message? Use only if truly needed. Yet, and this is the part most people miss, the scientific foundation for this guidance is anything but settled. While a handful of studies have hinted at a possible association between prenatal Tylenol use and later autism diagnoses, leading medical organizations continue to recommend acetaminophen as the safest option for pain relief in expectant mothers. No study has definitively proven a cause and effect relationship, and most experts argue that current evidence isn't robust enough to justify dramatic changes in clinical practice. The FDA also announced tentative plans to adjust Tylenol's labeling, suggesting acetaminophen may help reduce autism symptoms. This assertion added another layer of confusion, since it contradicts the main warning and lacks solid backing from large-scale clinical trials. Dr. Stephen Fleischman, head of the American College of Obstetricians and Gynecologists, ACOG, pushed back strongly. Blaming acetaminophen for autism is both alarming to care providers and potentially harmful to pregnant patients, he said in a prepared statement. He emphasized that such claims risk spreading unnecessary fear to those who genuinely need safe options for managing pain, fever, or discomfort during pregnancy. These announcements are not supported by comprehensive scientific evidence and dramatically oversimplify the complex factors that contribute to developmental disorders like autism. Making public health recommendations based on incomplete or unreliable data risks undermining both maternal and child health. Kenvue, Tylenol's manufacturer, echoed this sentiment in a statement of their own, insisting that current research does not support a link between acetaminophen and autism. We firmly oppose any suggestion to the contrary and are deeply troubled by the confusion this may cause, the company stated. Their main concern, taking Tylenol away from pregnant women, could force them to endure potentially harmful fevers or pain, or push them towards alternatives that may be less safe for both mother and baby. The controversy didn't stop there. Both President Trump and Health and Human Services Secretary Robert F. Kennedy Jr. went further, questioning the established safety of routine childhood vaccines and their alleged role in autism. This stance reverses decades of rigorous research consistently showing no connection between vaccination schedules and autism risk, certain to inflame an already contentious topic in public health circles. This story is far from over, and the conversation is more polarized than ever. As new updates emerge, what do you think? Do you support erring on the side of caution and restricting Tylenol use? Or do you stand with the majority of medical experts who trust the established science? Should health agencies issue broad warnings before there's consensus, or wait for stronger proof? Share your thoughts below. This is a debate that needs many voices.